Hi, this is Jessica DeMassa at the Guidewell Insights Lounge. I'm here with Dr. Anthony Chang, who's the Chief Intelligence and Innovation Officer for Orange County Children's Hospital.
Right.
So I have heard that you are
Yeah.
called Dr. AI by your friends.
I was coined by my friends, yeah.
So we want to hear from you from
Yeah.
the provider perspective. Tell us what's exciting in terms of the opportunity that artificial intelligence brings to healthcare delivery.
Well, I think with the amazing portfolio of artificial intelligence tools that are available now, from machine learning to deep learning to Watson and cognitive computing and all the analytics, it is just so ripe for medicine to come in and just take full advantage of all that. And I think, unfortunately, because doctors are usually pretty busy and maybe a little bit disenchanted with electronic records and don't want to deal with anything else right now, but it's the most exciting 25 years of medicine that are coming up. So,
What do you think is the most exciting thing about that? Like, why do you say that?
well, I think one is the whole area of precision medicine, which is
Okay.
going to be really fueled by artificial intelligence, because you can't do precision medicine with present day sort of computer technology and without using artificial intelligence. So can you imagine you walk into a doctor's office and he or she's going to give you your individual therapy and not just a certain milligram of a drug that he or she's going to give everybody else.
Right.
So that's just tremendously exciting. And then to have all the wearable technology and all the robotic technology be fueled by artificial intelligence. So think of artificial intelligence as not only about a robot, which
Okay.
is the common public concept of AI, but it's more about a special energy like electricity to make things smarter and better and faster.
Okay. So, how are these technologies? I mean, you're on the provider side of things, right?
Correct.
So, I mean, how are these technologies failing providers as they're being implemented right now in the system?
I think a big failure is just lack of recognition for what's available. I mean,
Okay.
if you talk to hundreds of doctors in a room, very few people would have heard of deep learning, which is really mainstream in terms of artificial intelligence. So if you don't know about something, you're probably not going to know how to take advantage of it. So I think we have a big gap to make up in terms of having the clinical world understand the power of artificial intelligence
Sure.
and its applications.
So, talk a little bit about some of those applications. What
Yeah.
problems should we be using this technology
Okay.
to solve?
I talked about 6 different areas during my talk, but one big area is going to be using machine learning or computers that will get smarter and smarter reading. For instance, all the MRI is going to be done in the world.
Okay.
Can you imagine the day that human beings are going to be peripherally involved but not directly involved in interpreting all the MRIs? Now, if you're a radiologist, it might be threatened by that, and understandably so, but the thing is, it's going to be an incredible burden for human radiologists. There are not going to be enough human radiologists to read all the studies,
Right.
and not enough pathologists and not enough dermatologists. So this is a tremendous asset to have if you're a radiologist, to have AI sort of as your ally rather than thinking of it as the robots are going to kick you off your job.
Right.
So,
So, how do we make sure that we keep the humanity in the application of
Yeah.
artificial intelligence, especially at the point of care delivery?
yeah, I think the most important takeaway I learned during my education at Stanford for 4 years is how important it is actually to have human beings interconnect and work on projects and use artificial intelligence, and at the same time never forgetting that it's the eye-to-eye contact, the human touch, that is still the most important thing in medicine. And
Yeah.
that's sometimes all the patient really needs from a physician or a nurse, is that hand on the shoulder, that pat on the back, that handshake. So it really is amazing that that is still the most powerful. In the middle of all this technology and artificial intelligence, that's by far the most powerful force, which maybe sometimes the robot will be able to
Maybe.
take on, but
Once you
it's
can
still
feel
a different
empathy.
tactile sensation, isn't it? So,
Definitely,
yeah.
without a doubt.
Yeah.
So, what has you most optimistic? I mean, we talk all, at xMed, we talk about the exponential technologies
Yeah.
and all of the things that have the potential to really transform the health industry. So, what makes you feel the most optimistic about the future of health?
I think what I feel most optimistic about is how the special force of artificial intelligence can be harnessed, just like electricity in the past, and really push medicine into a totally new era that's going to be tremendously exciting for the younger generation. I'm hoping to stick around a little bit to see it, but I'm a newly adopted parent of
Oh.
two young children with medical issues. So now, as my friends say, now your passion just got personal. So I'm really excited about the future of medicine. So.
Wonderful. Well, thank you so much for joining us
welcome.
here today.
You're
It was
welcome.
a pleasure to have you.
Pleasure
And
to be
thank
here.
you so much
Pleasure
for
to be
joining
here.
us in the Guidewell Insights Lounge.
Thank you.